Good morning. I am Andrei Harabor. I'm one of the neonatologists at the General, and the project for the cohort was about trying to optimize blood work in the NICU, as it seemed that there was significant variation to other, places of practice, and even between days and practitioners and all of that, and we had reasonable thoughts about the fact that that could result into maybe less blood work in general, less pokes, and potentially a little savings. And the main aim was that the number of tests and blood sampling episodes could be reduced by at least 10% when looking at it as a whole to the total number of tests performed per patient in the NICU. And this could be achieved without decreasing safety, which it means that we won't miss something that we should have caught with a blood test. So obviously, some thought was put into, well, what is this blood work about? And it's about many things, right? It's about ordering it, it's about lab processes, and it's about, patterns of care, which are different from place to place, and even from, depending on the density of providers, even between weekend and the regular week, and so on and so forth. So there are a number of factors, obviously, that play into this, and a few of them were reasonably approachable to everybody who came together in the team to do this. So we ended up with what looked like a beautiful team with representatives from the orders, and then the nursing and the lab. PFA was fantastic, and it seemed like the consensus was fairly easy to achieve on the core principles and a few ways to go forward. And then there's obviously a big piece of lab to this, and that worked well for a while. And eventually everybody agreed what we were going to do in our first cycle. And then there was a fair amount of work and gather the data about all the testing in NICU over the previous 3 years, and preparing, doing a lot of manual data cleaning up and sorting out so we can do some run charts and all of that. And, our lab counterpart was very sweet, and we went through. So this is an example of a standard and a trend one. And you'll see that. So the one that this is it's the lights, and this is renal panels, and then it should have moved. But then what happened was there was really extraordinary turnover in the division, and 3 out of the 5 consultants disappeared, and new came in, and a number of our clinical also came in. The maternal child director and the unit manager changed as well. It was just this extraordinary personnel change, and of course everybody was overwhelmed with COVID, and the lab was one of the key areas. So we are just going back to it right now, and trying to move into a first cycle and take it from there. So the key learnings would be that really improvement is all about the mindset, and the mindset is that it's a biological thing. Life is change, and change can be accepted and controlled collectively, and if it is, it becomes improvement, and if it isn't, while it's just change. And then the other piece is that everybody in the community has to really be with it. Otherwise, it doesn't work. And that's, well, just like this COVID, obstacles will come and go. We just have to, if we have it in our heart, we will see the end of it, and that's really cool. And I obviously want to say that this has been an absolute blast, and I've enjoyed every second of it, and I'm very thankful to the faculty as well as to our peers and co-cohorters. It has been fantastic. Thank you very much.